The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I'm being joined by my friend Dr. Jared Chapman from Living Well. Dr. Chapman, thanks for being with us.
Thank you for having me.
Last time we talked about an area of the face that we tend to show aging first, and that's the eye area. And we talked about the procedure, Bright Eyes, that you do there at Living Well that gives everyone a fresher look, a well-rested look. Another area of concern is our lips. We all want those nice, luscious, full lips. So what can you do at Living Well to help us get that?
So by using filler in the lips, we can create a more youthful appearing lip. As we all know, as we begin to age, the lip gets thinner, whether by just the things we do, from sucking on straws and the way we eat and talk, to the sun naturally aging around our mouth. Also, the skeletal structure begins to shrink. We lose collagen, we lose elastin, we lose hyaluronic acid. So we have all of these things working against us as we begin to progress through life that take the volume away from the lower face. And a lot of times, my younger patients come in and they just want those luscious lips that they're seeing in the magazines and they're seeing,
Right.
On the television. And those are pretty much easily achieved in a more youthful lip. But as we get older, we're not necessarily looking for a big lip. We're looking for a lip that has structure and maybe a lip that doesn't have the little fine lines all above it and around it. And those fine lines, they call them oral rhytids. If you're reading and you see that word, that's what that is. And it's just the fine lines that are developing around the lips. So we have two products we use in the lips. We use Volbella, which is the newer product that Allergan has that actually works to restore structure. I say restore structure. I use it more of a structured type filler, even though it's one of the softer fillers out there. I feel when used in a certain way, we can add structure to the lip and not a lot of volume. Okay. And then we use a product called Ultra in the lips, which has been around for years, and it is approved by the FDA for use in the lip to restore loss of volume. So by using these two products, depending on what we're looking for, we can give a more natural look to the aging lip, or we can give a volumized look to the younger lip. So it just depends. Each person comes in, the first thing I hear is, don't make me look like someone out there in Hollywood, and they'll use a name, or I saw so-and-so, I don't want her lips, and I always say, no, I'm just going to give you a better version of your lip. Right. I'm going to restore a little bit of volume. I'm going to try to work to remove the fine lines and wrinkles above the lip, and I want it to look natural. A lot of times you need to look at the other features of the face. You need to look at the chin, the nose, the eyes. How does all of this balance on the face? A lot of times I see lips that are just completely out of balance on the face, and those are the lips we don't want to create. What we want to create are lips that enhance the balance to the face, because they're the anchor. They're the bottom of the face. They're the last place the eye will rest as we're scanning a patient's face or a person's face. It's the last area we stop before we look away. I like to create an arc of light right above the lip here and right on the lower lip. When I can get the light to balance on the lip properly, then I feel that I've done a good job at recreating the proportions that the patient naturally has.
Right.
So
right.
That's one of the ways that I look at looking at a lip. And, when people come to me, I have done lips for 10 years. I've probably injected thousands of lips. And to be honest with you, I try to give the patient the most natural look that they can have. I always say the next 48 hours after injections, your lips are going to look huge to you.
Right.
They're going to feel huge to you. As soon as I put the mirror in front of your face, you're going to think they're huge. And most of the time, they always say, I want them to look like they did when you first did them, after they've settled a little bit. So, right. But it's just getting used to that initial shock once they take the look, because they usually had no lip and you give them the lips. So the lips are a great way to balance the face. They're a nice touch. They're not. It's a great way to start if you've never done injectables before. It's a nice place to start because there's not a lot of injecting going on. It's just that one area. It probably is one of the more uncomfortable things to do, but we use a nice numbing cream that really numbs the lip up and takes most of the discomfort out. I would say on a scale of 1 to 10, it's probably a 4 on the scale.
Okay.
Or 4
Not
to
bad.
5.
Not bad.
It stings and it can make you tear a little bit. So, but we just get you through it.
Just get through that initial shock and you'll be fine.